Hello, my name is Dr. Abigail. I'm going to talk to you today about 6 factors that make couples therapy effective. The first factor is choosing the right therapist. Unfortunately, couples therapy in the UK is not a protected term, so anybody can use this term. The counsellors who've done individual training then advertise for couples therapy, but it's a very specific training needed. So I'd make sure that whoever you see has got actual couples therapy training. Also, choosing the right therapist. Please think about people who use evidence-based interventions. While providing a safe space is a really lovely thing to do, research has been shown that an effective intervention is really important as well. For example, Benson 2012 looked at 40 years of couples therapy and boiled all that information down into 5 main factors that make couples therapy effective, and I'm going to talk about those now. The second factor that makes couples therapy effective is that the therapist actively helps the couple see their relationship differently. And this can be done by the therapist collecting data on what's happening in the relationship in the room and the past histories and childhoods of both clients. And this creates a hypothesis for the counsellor that they then feed back into what's happening for the couple. And this helps them know what causal factors are actually leading to the problems that they're having right now. The third factor that makes couples therapy effective is having a therapist that directly modifies dysfunctional behaviour. So when we talk about dysfunctional behaviour, we're really talking about communication. The Gottman Institute are fantastic, and they're in America, and they looked at thousands of couples and they could predict with 95% accuracy which couples would end in divorce. How did they do this? They looked at a 1-hour interaction between the couple at the beginning of their sort of love part of the relationship, and they could predict within 10 years whether they would have ended the relationship or not. What they found is the way we use our words towards our partner and the way our body language is can contain something called contempt. And if that's there, that's a big predictor that the relationship will end no matter what else is going on. It's important that an effective couples therapist is able to name these kind of interactions when they see them within the couple and educate the couple so they can know that without realising it, maybe they're actually using forms of dysfunctional communication towards each other that are slowly eroding their relationship. A fourth factor that makes couples therapy effective is having a therapist that decreases emotional avoidance between the couple. So they provide an environment where both couples, and they encourage both couples to talk about their intimate thoughts and their intimate feelings, and they make a balance so both people have a say within the room. They also keep an eye on something called attachment, because sometimes if somebody hasn't had a good experience of being emotionally intimate when they were younger, they may be very scared to actually do that with their partner and may feel fear, rejection. So it's important that a couple therapist can note this and pick up on it and encourage first the party who doesn't feel safe to learn to feel safe to talk about these things, and secondly that the other partner encourages them so there isn't any rejection set up. So an effective couple therapist will be mindful all the time on these forms of communication and what's going on and the levels of intimacy and why this might be happening or not happening between parties, and try and balance that for both sides. The fifth factor that makes couples therapy effective is when a couple therapist actually teaches communication skills. So this is effective communication skills. So bringing down this massive body of psychological knowledge and delivering it to the couple to help them improve their relationship. So this is ways of improving communication, improving how to argue in a healthy way. There's healthy arguing rules, teaching a body of psychological knowledge to this couple so they can take that on and begin to weave that into their relationship. An effective couple therapist won't be just being quiet and listening. While there is a time for that, there is also a time for teaching and for coaching and maybe even role-playing different ways of communication. The sixth factor that makes couples therapy effective is for the therapist to promote the strength and resilience of the couple. Whilst lots of couples that come into therapy have many difficulties and are focusing on the difficulties, there often can be quite small areas of resilience and strength, and it's important that the couple therapist focus on this as well and help the couple to see these areas and to do what's working more. So to summarise, that's the 6 factors that through research of 40 years shows makes effective couples therapy. I've got a lovely new couples therapist that started at my practice, Deborah Lewis, who very much bases her approach on all these different factors that we've talked about today. If you'd like to book in with Deborah, then email me at inquiry@drabigail.co.uk or visit my website drabigail.co.uk. Thank you.